Thank you, Jamie. So good afternoon, everyone. I'm Sarah Dugan. I'm a mental health pharmacist and faculty here at NeoMed, and I'm doing our didactic today, which is a journal club. So the article is posted on the iEcho platform, as well as the slides, which I forgot I had to post, so I did not post them until later this morning, so my apologies. All right. Our objectives for this brief didactic presentation. So we're going to look at this publication. So this is one of the few random controlled trials that we have looking specifically at microdosing of psychedelic agents. This one just happens to be looking at psilocybin. We're going to evaluate what they did and then take a look at what the results are and what this may mean for clinical practice. I won't spoil it for you if you haven't taken a look at the article yet. So here is the citation. If you'd like it, as I mentioned, the PDF version of this is posted on the iEcho platform for you. This has been, microdosing of psychedelic medications has been in the lay media quite a bit recently. If you look over the past approximately 5 to 7 years, there have been increasing numbers of reports of individuals who are microdosing different psychedelic medications. This includes LSD, this includes ayahuasca, it also includes psilocybin. I would say between LSD and psilocybin, those tend to be the two most frequently utilized. Individuals are looking to microdose and dose on a more consistent basis versus just taking the full dose psychedelic products that they're able to get access to. When they take the full dose product, there tends to be much more impairment in their ability to execute higher demanding executive functions. But the microdoses have been proposed to be used to assist with kind of allowing people to break out of the box, if you will. So helping with some of their cognitive functioning, helping them get into a flow state where they're much more efficient. There's been some discussion that maybe this can help with things like creativity, more innovative problem solving. There are anecdotal reports that there's an enhanced mood. There are some degrees of perception changes that are beneficial to an individual's ability to perform. So really looking at this is a way to hone one's skills and be able to perform it at their utmost level. One of the most recent lay media articles that had come out was highlighted on Drudge Report approximately a month ago, and it was looking at individuals who are working mothers who are microdosing specifically psilocybin, and they're looking at it to enhance their energy, to improve their performance and efficiency when they have very busy schedules. So that's the desired effect. Is there information? Not much. There are several lay media articles. So if you go to search for that on a regular search engine, mostly it'll bring up these stories that are in the media. There are a few open label trials, and then there are some online survey trials, as well as case reports, so more anecdotal reports of individuals who have been using microdosing. Not a surprise from the publication bias standpoint with those particular types of trials, it very much is skewed in a positive direction, that this has been incredibly effective, that there are not really too many concerns about it. So there's been some interest in trying to standardize things and look at it under a little bit more of a rigorous lens. One of the trials I was able to find was an online survey. So it identified adults who had previously utilized any type of psychedelic medication. So this included psilocybin as well as a number of other psychedelics. Interestingly, of the over 1,000 patients, there were, I think it was about 900, so almost 80% of them were currently microdosing. So it seems that folks who have used psychedelics in the past are pretty likely to be the ones experimenting with microdosing. This didn't come out incredibly easy to see, but the chart at the bottom looked at rationale. So why were they microdosing? What were they hoping to get out of it? So enhanced creativity is that second bar from the left, the black bar. That tends to be one of the biggest rationales. The highest one, which is 1, 2, 3, 4, 5, 6, 7, the seventh one over from the left, so that tall gray bar, enhanced mood. So enhanced mood, enhanced creativity are really leading the way in why folks are doing this. General curiosity, psychological symptoms, increased concentration, as well as increased energy kind of round out the rest of them. So similar to what we just talked about with desired effect, that these are what they're reporting. They're using the microdosing of psychedelics for. What they've found with a number of these is while we have limited, structured, rigorous clinical trial data, there is a definite selection bias. So in addition to there being publication bias, the folks who are being recruited for these type of trials tend to be ones who are interested in microdosing, individuals who have used psychedelics or are interested in microdosing psychedelics themselves and have very positive impressions. They tend to be pretty honed in on the effects that they get from the psychedelic medications, and we don't tend to see as balanced a perspective in terms of what's happening. So they may be reporting enhanced energy, enhanced creativity, but there's no way to tell if that actually is the case, which is where this particular article came into play. So the objective that the investigators had, oh, and I just had one more thing I wanted to say about that online survey. Despite 80% of them exploring microdosing, there are about a quarter of them that did report a negative effects. So they did endorse that they had negative effects, although it wasn't necessarily a complete deterrent to them continuing to pursue microdosing in the future. So the authors really wanted to look at what are the effects. Is there a way to more objectively measure this? So they wanted to determine the effects of low doses of psilocybin on behavior, creativity, perception, cognition, and they also wanted to look at underlying brain activity. So in addition to a number of the rating scales, they wanted to see if there were actually functioning differences in the brain while individuals were awake. So they were going to use an EEG to be able to measure that. So how are they going to do this? It was a randomized, double-blind, placebo-controlled trial that was a crossover model. So the actual participation was over the course of 3 weeks. During the first week, Group A was given a particular treatment. They were randomized between either getting psilocybin or getting a regular ground up dried edible mushroom. They both were put in gel capsules. They were ground up and added with additional filler. It was 500 milligrams, and it was administered twice during that first week. There then was, and there was a whole bunch of assessments that happened throughout the week. Week 2 is a break, and then week 3, they got the opposite. So for individuals who received psilocybin in the first week, they received the placebo. For those who had received the placebo, just the edible mushrooms, they received the psilocybin in that 3rd week, and there was a whole bunch of evaluations that went on. So they were able to look at both measurements of the scales that we're about to look at between individuals, as well as comparing the individuals, the active versus the placebo group. There were a ton of objective measures that they used in terms of outcome measures. So I actually split them into 2 different tables. If you look at the article itself, it has it all in one, but it would make the font itty bitty. So that was why I didn't do it here. But they wanted to be able to speak to all of these different areas where individuals were saying the microdosing of psilocybin would be beneficial. I'm going to start with the acute subjective effects. So this is a list of approximately 21 different effects that have been reported by individuals who use psychedelic medications. It was on a visual analog scale, so it was essentially almost like the faces on a pain scale, and they'd be able to point out where they were for any of those particular findings. Things like imagination and mind wandering, things like that were all included on there. This was measured starting on Wednesday of the week, and then it continued Wednesday, Thursday, Friday, Saturday. So they didn't measure it initially. They wanted to measure it after the individual had received their dose. They looked at changes in personality. They looked at changes in anxiety, suggestibility, their openness to other suggestions, perceptions, some of their attention, their ability to concentrate and focus, overall brain activity, as well as their physical activity. So that did this change kind of their energy level and how motivated and active they were. The activity was also measured every single day of the week. So Monday, Tuesday, Wednesday, that's a lie, not on Sunday. Monday, Tuesday, Wednesday, Thursday, Friday, Saturday. They didn't do any assessments on Sunday. The rest of these were only measured on the day of the week that's mentioned. So it was done both the week that they took the psilocybin as well as the week that they took the placebo. They looked at a number of other kind of executive processing scales, as are mentioned here. So this was a pretty robust evaluation that was done by the individuals. These were just all of the ones that were done on Friday, which is why I split them in between two. But they really were looking at, for individuals, the Wednesday and Friday were the dosing days. The other days, they were trying to take measurements more on what the baseline was for the patients just in their everyday activities. But it was a pretty big time commitment. And I point that out. When we get to the participants, I'm going to bring that back. From a statistical analysis standpoint, they primarily compared active to placebo. So what the active scores were when they were on the psilocybin compared to the placebo mushroom. They used a number of different non-parametric tests, which makes sense because we didn't expect it to be very normally distributed. But they did a lot of comparisons. They did comparisons between individuals. They also did comparisons, as we'll talk about in a minute, with the blinding, whether or not the folks knew whether or not they were on a psychedelic or not. So they did use the correction once they started doing those extra comparisons. That correction made sense because if they had statistically significant results and they didn't use the correction, it could have just been by chance. Because of the concern that was noted in the beginning that there are many individuals who are sensitive to the effects, they wanted to see if folks could unblind it. So they let the individuals know once they were done with the whole study which treatment they had been on during which week. But they did ask them ahead of time to try to see if they knew which they had been given. Because if they did know, not that they confirmed or denied it, but they wanted to take that into account when they did the statistical analysis, because if I think that I'm on it and I actually am on it, then maybe I'll score some of those rating scales a little bit differently because I do believe I'm on the psilocybin. So that was their attempt to try to get into and alleviate some of the bias. So what actually happened? So the individuals that they recruited, so they recruited adults. They were adults that were recruited by word of mouth, that were recruited by social media. But one of the other places was the number of workshops in this particular area, the workshops that were done on the use of psilocybin, as well as workshops on microdosing of psychedelics in general. So as opposed to a broad capture or invitation for individuals, this really targeted a population of folks who were interested or may already be using some of the psychedelic medications. There were more men than women that were enrolled. They were adults. The average age was in the early 30s. The majority of the patients had used psilocybin in the past. So almost all of them had been reported to use it in the past. And on average, they had used psilocybin about 11 different times. So these were not necessarily individuals who were new to the game. They were individuals who had had a number of experiences with the psychedelics in the past. They did ask them about those experiences on psychedelic medications and if any of them were difficult, negative, or challenging. And on average, they said about 1.5 of those experiences were described as challenging. So these were folks who had had both positive experiences as well as not positive experiences, but were still coming back to use the psilocybin. I want you to kind of keep that in mind as we move into the results. They did ask the individuals, and unfortunately, most of them were able to tell which treatment they were on. So 75% of them were able to identify if they were on active treatment, and that should say active treatment or placebo. So 3/4 were able to identify that. Interestingly, it was not during the first week. So if you remember the way it was set up, they got 2 doses week 1. They took that whole battery of tests. There was a break week 2, and then they received 2 doses in the second week. They were not as well able to identify what they were on during week 1, but during week 2, that was where they saw that many of them were able to say, yeah, I think I'm on this, or now I think I'm on placebo. And it was pretty even between the 2 groups. So it was almost that they used the first week's experience to be able to determine what they now were being exposed to. Because of that, because there was the vast majority were able to do that, they did look at some of the results in terms of those that were unblinded and kind of knew what they were on, and those that were blinded. So we will include that as we talk about the results. So first of all, the acute effects. So that visual analog scale where they looked at the 21 different aspects, there were significantly more acute effects that were reported with psilocybin than with just the edible mushroom, the placebo group. So many more of them, once they had taken the dose, did have those symptoms compared to those that were on placebo. Interestingly, despite there being reports that beneficial effects of psychedelics can be extended beyond just the day of dosing, that's not what they saw. They only saw a difference on the days that the patients took their medication. So if you'll remember, this was the subjective effects, and it was administered Wednesday, Thursday, Friday, Saturday. So on Wednesday and Friday, there was a significant difference, but on Thursday and Saturday, Wednesday and Friday, there was a significant difference. They were dosed. Thursday and Saturday, they were not dosed, and there was not a significant difference. So there wasn't a carryover effect to the next day. When they looked at the patients who knew what they were on versus those who didn't, there was a significant difference. So likely there was a bias in some of the reporting where those patients had a much higher rating in their subjective effects than those that were blinded, that didn't know what they were on. They looked at each of the individual categories. And unfortunately, when they used the correction for multiple comparisons, there was no significant difference. But when they just did the flat out analysis without that correction, they did see a slight difference. So imagination, having a dreamlike quality to the experience, spatial distortion, as well as mind wandering was more pronounced in the patients who were on psilocybin versus those who were on placebo. When they looked at some of the other questionnaires, so these are, I tried to blow them up a little bit so you can see them. The blue boxes are the placebo, the yellow or orange boxes are the psilocybin. This includes a number of the attention, anxiety, some of the processing scales. The word escapes me completely. so a number of those different scales, not so much the cognition, but attention and concentration, some of the focus things. There was no difference. If you look at all of these boxes, there was no difference between the placebo and the psilocybin on the vast majority of these behavioral pieces, some of the anxiety or psychological, some of the mood evaluations that were here. There was no difference between the two groups. Cognition and perception, exact same thing. So again, placebo is the blue, psilocybin is that yellow or orangey color. There was no difference between the two groups on any of these tests and domains for cognition or perception. So they really weren't seeing as much of a change, unfortunately, on these objective measures. How about the EEG? So if they didn't respond on those rating scales and questionnaires, did we actually see differences in some of the brain waves? The answer is yes. So again, blue is placebo, that yellow orangey color is psilocybin. There was one difference that they saw. So when individuals had their eyes, so they did a 5-minute evaluation with individuals with their eyes open and a 5-minute EEG reading with their eyes closed. With the eyes closed, there was a difference in theta waves for the patients who were on psilocybin. So they saw less activity in those patients with the theta waves with psilocybin than they did with the placebo. That did not translate into any type of specific clinical effects. So that was the only statistically significant difference that they saw in those groups. Last evaluation that they were looking at was physical activity. This is why I didn't spoil it, because that would have taken away my thunder throughout all of these result slides. There was no difference here either. So we really didn't see much. So despite the fact that they knew they were on something different, those objective measures did not demonstrate that there was a difference between the two groups. So what does this mean? So from a strength and limitation perspective, they really developed a robust assessment plan. So there was a whole battery of tests that were done to try to evaluate all of those potential areas where individuals say they're getting benefit from the microdosing of the psilocybin. They did it as objectively as possible, including using the EEG to measure some of the brain waves. The population bias, though, who they recruited was already an experienced patient population who had an interest in microdosing, and they were unable to maintain the blinding. I don't think Doug's on here, but as he's pointed out a couple times, when we have some of these psychedelic medications, it's really hard to have a true blinding, because individuals know if they're feeling some of those effects or not. And this is another example of, even despite the fact that they were trying to use low doses, there was a distinct difference between the two that was picked up on by the participants. So they were able to figure out what they were on by the second week. So if they had active treatment the first week, they weren't quite as likely to be able to identify that. So that may have insulated some of those results. So maybe not doing the crossover would assist with the power there. But across the board, we did not see a difference in the vast majority of those objective measures. So yes, subjectively, the effects once they had taken the medication on Wednesday and Friday, there were more of those in the psilocybin group. Considering they knew that they were on it, I guess that shouldn't necessarily be a surprise. But there weren't specific areas that were stronger than others. So the mind wandering, the imagination, that dreamlike quality, yeah, that was more pronounced in those patients, but it wasn't strong enough to hold through when they corrected it for the multiple comparisons. So unfortunately, we don't have a lot of evidence right now that microdosing the psychedelic medications, specifically psilocybin, is beneficial for all of those anecdotal effects. So from a clinical impact, based on what we have right now, there's not a lot of support to at this time to say that yes, microdosing these medications can increase creativity, problem solving, energy, mood, things like that. The bias appears to be driving some of the results that are there. So we really do need this was a very small sample size. This was only 34 patients, but we really do need a much more robust cohort to be able to collect some additional information and see if this would be worth pursuing. So despite what you hear in the media, we don't have much to support that at this point.